Good afternoon, good evening, everyone. My name is Letitia Latiker, and I am the director of the Women's Foundation of Mississippi. And I want to thank everyone for joining us tonight for the Jackson, Mississippi alumni chapter of Delta Sigma Theta's Sorority Incorporated event. And as we take a look at uh, maternal health as well as Medicaid expansion in the state. We have an illustrious panel of individuals who are experts in their own right, who are going to bring us great and wonderful information as the night carries on. As we begin to get started, I'd like to introduce our panelists, and then from there we will begin our discussion around the issue of maternal health and the state of Mississippi, as well as Medicaid expansion as it applies to maternal health. Without further ado, I will introduce our panel. I would like to also let the audience know that we did have another panelist scheduled to be on with us, Miss Shalonda Spencer, but she did have a family situation arise and she was not able to join us. And so now we will have a fellow JMAC member and Social Action co-chair, Miss Sharita Young. In addition, and I will be remiss before I begin introductions as well to bring up our HBCU campaign when they see us for the month of January through May. The JMAC members of Delta Sigma Theta, Jackson, Mississippi Alumni Chapter members of Delta Sigma Theta, are having a fundraiser to benefit our 5 HBCU campuses on the state of Mississippi. That's Alcorn State, that's Jackson State, Mississippi Valley State, Tougaloo, and Rusk College. And through this campaign, we're looking to raise $100,000 by May 31st. All donations are tax deductible, and we encourage you to donate as much as you can. $5, 50 cents. We'll take any donation. But at the end of the campaign, the funds will be sent to the 5 distinct HBCU colleges and universities in the state of Mississippi. As you see going across our screen, we have a text to give campaign. So we ask that you to text HBCU to 53555 to donate. And you can even designate which of your favorite HBCUs you would like for your donation to go to. And so without further ado, I will go into our formal introductions. And from there, we will begin our panel discussion. I would like to begin with Senator Hillman Frazier, who is the Senator for District 27 in the Mississippi Senate, and he is a staunch supporter of women's rights, of the not only women's rights, but rights of those who are less fortunate in the state. And anything that is good, usually Senator Frazier's name is attached to it in the Mississippi legislature. He was absolutely the one of the great proponents of the flag being changed, and if including other bills such as ensuring that breastfeeding is a right in the state of Mississippi. So I can't sing the praises of Senator Hillman Frazier enough. I'm sure if there's other things, I don't want to give a full formal introduction because we know that Hillman Frazier is our friend, and most of us on this call probably know Senator Frazier. That being said, we'll move to Dr. Sandra Melvin, who is the Executive Director of the Institutes for Advancement of Minority Health. She has a strong background in epidemiology and is a wonderful community partner and a strong advocate for women's health as well as minority health. And last but not least is Dr. Nikitra Burse, who is the Executive Director of Six Dimensions LLC. She comes also with a wealth of information and knowledge with a background in public health, and is a firestorm in her own right, as well as a documentary maker. And so with all that being said, we would like to jump into our panel and really discuss the issues that are on hand. And the first thing I would like to address is, what is the state of maternal health? And we have a young man who's joined us, but Dr. Burse, this is, as I told you before, this is life. And so we do love the fact that we have our little coworkers that join us on time to time. with that being said, could our panelists really address the state of maternal health in the state of Mississippi? What is going good? Where are challenges, and what can the state of Mississippi do to address those challenges? Dr. Melvin?
Well, I guess I'll start it off with just a brief background on where we are in terms of the numbers. As an epidemiologist, I'm always looking at the numbers. And so one of the things I like to say is that the health of any society can be measured by the health of its women and children. And so that's why it's really important for us to invest in our maternal and child health initiatives. One of the things that we know is that infant mortality rates in African American communities is 2 to 3 times that of white communities. We also know that we see a disturbing trend in deaths among women and during childbirth. So maternal mortality in Mississippi is another indicator of the quality of health and healthcare experienced by women in the state. And in Mississippi, the pregnancy related mortality rate for Black women is nearly 3 times that of white women. And so it's really important that we expand the safety net, which is what Medicaid expansion is, to make healthcare accessible and available, especially as it relates to maternal and child health services to minority and underserved communities here in the state.
Thank you, Dr. Melvin. And I'm glad you mentioned, and we'll come to other ones, but I want to go ahead and get this on the plate before we get too deep in the discussion. I want to go to Senator Frazier, and if he could provide some input for us about Medicaid and Medicaid expansion, and why is it so important to the state of Mississippi?
Right. It's very important that we take a very hard look at Medicaid expansion in our state. Our neighboring states have expanded Medicaid because it benefits the people they serve. They look at it as a public health issue. In Mississippi, our policymakers have been looking at Medicaid expansion as a political issue. Who's going to get the credit? Who's going to be served? So that has been a big deterrent in terms of why we have not expanded Medicaid. Our governor has been speaking against that. But on the positive side, we are making moves in our state legislature to expand Medicaid the way we can without the governor's input. Just this week alone, on yesterday, we passed a bill in the Senate that would expand Medicaid coverage postpartum cases from 6 to 12 months. That's a step in the right direction. We're doing that because we realize that women need health care coverage after that, because they know that they've been in a position to recognize different healthcare challenges that children have. But by extending it, we'll be able to catch those children. But in Mississippi, we have to make sure that we work very hard to make sure that we address Medicaid and also look at it as a public health issue as opposed to political issue. We've been penalized because politicians have been looking at that as a political issue as opposed to a public health issue. But it's a public health issue. It's been expanded in other states, and we're defending them. And also, by expanding Medicaid, we're going to make health care more accessible throughout the state. A lot of our hospitals are closing in our state because they don't have the funds to do so. But expanding Medicaid, we can provide additional relief to some of these hospitals throughout the state of Mississippi.
Thank you, Senator Frazier. And Dr. Burse, I'll come to you. If you can expound on our initial question on what is maternal health and why it's so important to the state of Mississippi, and how and what can Mississippi be doing better?
Yeah, thank you all for having us on tonight. And I agree with Dr. Melvin, but it's an issue in Mississippi, but it's also an issue across the country. And Mississippi is trending the same direction the country is, and even higher in some areas. But it's not just this singular issue of we need access, but we need access to everything. And so when we look at Black women, particularly, health it encompasses everything. So it's our mental health. So when we look at these reports around maternal mortality, our women are dying from issues such as heart disease, preeclampsia, substance use, suicide. So there are this range of issues that women are facing when it comes to maternal health, and it's not just this singular focus. And so just to hear that, the extension to 12 months is hopefully it's going in the right direction, that would be paramount for us, because when we even look at the reports, the previous maternal mortality review report, it reviewed deaths between 2013 and 2016. And of those deaths, 37% died after that 60-day period. And that would be when women drop off of Medicaid. And so people often think that a maternal death is just, a mom goes into the hospital and dies giving birth. No, that goes up to that 12 months. And so many of those deaths happen after that 60-day period. And so what I always think, what could happen if they had access, if we had access, that would decrease our chances of going to the ER when something is, we're very acute illness. That would, really increase our chances of having that coordinated care when it comes to you leaving out of, your OBGYN and going into other care. So there are a lot of reasons why this is, best for our women, especially our Black women. But as Dr. Melvin said, we're dying at 3 to 4 times the rate of white women, and that's in the country, and that's in the state. And that I think the actual number is 51.9 deaths per 100,000. And so that's a lot. That's a lot. And when you look at it, you think, well, how many of those could we have prevented if we had these measures in place?
Absolutely. That is astonishing numbers that the women who are dying and at such a high rate. You think about especially the rate for women of color, especially Black women. And we should not have to be the face of Beyonce or Serena Williams for alarm to be raised. Could you expound on that? What happens in that 60-day window? Because currently, right now, that women who do give birth on Medicaid only have that window of 60 days. Could you expound a little bit more? Because I know you mentioned some of the other issues, but could you expound a little bit more on what beyond those 60 days happens and how to reduce some of those issues that happen after that 60-day mark?
Yeah. So, I mean, whatever happens within those 60 days can happen beyond, and we don't often think about that. So even thinking about postpartum preeclampsia, high blood pressure, if I'm having this swimming headache daily, will I go to the doctor if I don't have health insurance? So that even happens beyond the 60-day period. Thinking about mental health issues, we always talk about postpartum depression, the baby blues. Well, when that baby blues keeps going on, we need to get into care. And if we don't have access to care, then, the issue is exacerbated. And unfortunately, some get to a point where, they may die by suicide. So that's a horrific issue that happens, in our state as well. Also, just that access to care. We've seen many of those, well, not many, but a couple of stories here recently in our news over the last, maybe 5 years or so, where women were pregnant, trying to get to care, and rural hospitals are closed. And so they don't have access to that really acute care, even during pregnancy. So beyond that period, your chances of going back at that point, we're in the motion of taking care of baby, taking care of family, trying to get adjusted. And, in normal circumstances, our health comes last, because that's what we do as Black women. But in a situation where you don't have access to care, not economically secure, housing insecure, then it's trying to meet basic needs. And so that happens. Those basic needs don't stop after 60 days. Those health issues don't stop after 60 days. And when you think about maybe a mom who even has underlying health issues, which chronic illness, such as maybe obesity, diabetes, that also exacerbates your chances, or increases your chances of having complications. And so to be able to treat all those things at the same time is important, and it doesn't often happen. It's so fragmented, the system is.
Letitia, can I just add just a little bit to that?
Absolutely, because I had a question for you, Dr. Melvin, as to when is a woman, particularly not to get too deep in the woods, but when is a woman out of that critical danger window, if she's ever out of it, and what's the role of preconception that plays into a woman's health? But also add what you had as well.
Okay. So, and I guess this will tie in, because one of the things that I think we have to understand when we talk about expanding Medicaid is that we're giving people access to healthcare services. And even when your name is Serena Williams, you have issues when you can't communicate with your doctor. She almost died when she had her baby because she knew something was wrong. But because she was Serena Williams, she was assertive enough to have them to make sure that what she was feeling was really something wrong. And so if a woman is able to develop a relationship with a doctor, which is what you're able to do if you have consistent coverage, then you are able to make sure that when things are not right and you know they're not right, you have a healthcare provider that will listen to you. Now, the other thing about your question about when they're out of the critical stage, I'm not a physician, so I won't say that I can tell you exactly when, but what I will say is that having access to care gives you access prior to, during, and after your birth. And so I think that when we talk about childbirth, a lot of people think, well, after 48 hours, after 6, because they discharge you after 48 hours. That was my experience. And so if you don't have any complications, 48 hours later, you're going home and you're a new mother. First of all, you don't even know if your body is okay, because you still have changes that are going on in your body after giving birth. So the critical stage is when you know that you feel okay. So if you're still feeling depression, if you're still feeling anxious, overwhelmed, then you still need to have access to healthcare services to make sure, first of all, that you're okay, but also for your baby. Because remember, some women take their babies home and they aren't quite sure what's the appropriate thing for if their baby is okay. We have babies dying of SIDS early. A lot of Black babies die before their first year of birth. And I think some of it is because maybe the mothers don't notice things that are not right. And maybe they're not noticing because they don't have that relationship with primary health care that would help them to detect some things early. So the critical thing is really based on who you are, and also you being able to get to a doctor to be able to talk about those things when you see something is wrong.
Absolutely. Senator Frazier, I want to come to you for this particular question. What would be the impact on the state's budget if the state were to, first of all, expand postpartum Medicaid, and overall, if the state were to expand to take Medicaid expansion in general? If you have any knowledge on that, or some input on what would actually expanding Medicaid, at least postpartum to those 12 months, do to the state budget?
Right. That's not going to have a big impact on the state budget because the federal government, we're paying most of the cost. If you look at expanding Medicaid in the state, we're looking at a 9-to-1 match. And that means the federal government is paying 90%, the state is paying 10%. And they have incentives that will pick up that other 10%. We've had hospital administrators coming to us telling us that if we expand Medicaid, they would put up the 10% for us. So it won't have a very big impact on the state budget at all. But it will do one thing for us. It would make healthcare more accessible in the state. And by being more accessible, you have more healthy people you're dealing with, students, parents, mothers. So it's going to help our bottom line in terms of hospital costs. So expanding Medicaid is going to be a big cost saving for the state of Mississippi in terms of what we're reaping in return. But in terms of the cost at this point, it's going to be very minimal because most of the costs will be picked up by the federal government, and also the Hospital Association is talking about coming up with 10% that we might need to expand Medicaid in the state.
That's a pretty audacious offer for the Hospital Association to offer up that match. So in that line of thinking, with Medicaid expansion being on the table, is there currently a bill making it through the legislature that will address at least the 12-month postpartum Medicaid expansion?
We did pass that yesterday in the Mississippi Senate, Senate Bill number 2033. It passed the Senate on yesterday, authored by Senator Blackwell. And so that bill will be going to the House for further consideration. Because we realize there's certain things we can't do without the government input. We can do something that would impact our mothers. So this is one of the things we thought that we could do. And we did it yesterday in the state Senate. And we hope that the House comes on board doing it, because it's going to benefit our mothers and children, because a lot of our children, a lot of babies are diagnosed with different problems after that 6-day period of time. We noticed going from county to county, we have some students, some babies who suffer with asthma and other childhood diseases. By expanding to 12 months, we have a chance to catch those early on and give them proper health treatments they need at that point.
And so you said Senator Blackwell was the author of Senate Bill 2033, correct?
2033 did pass the Senate on yesterday.
Wonderful. And so who is the champion in the House? And does the House have a number as of right now?
I haven't seen a companion bill in the House at this point in time, but the chairperson of the Public Health Committee in the House is Representative Mims from Macomb, Mississippi. But like I said, you have a lot of advocates, a lot of Democrats in the Senate and the House have been advocating for expansion for many years. Our Democratic leader on the House and Senate side has been very vocal in terms of the benefit of expanding Medicaid in this state. But like I said, the Republicans have a supermajority, and they're looking at this as a political issue as opposed to a public health issue. But I must give our Governor David Holtzman credit. He's looking at it in terms of real public policy as opposed to political issues. He's trying to find out ways we can expand it. He might want to call it something else as opposed to Medicaid expansion, but he gets it. He realizes that if we expand Medicaid in this state, we're going to help the people we represent. Healthier Mississippi is going to mean a more vibrant Mississippi. So that's our goal right now, trying to make sure we have health services more accessible to everybody in the state. By expanding Medicaid in the state, we will make healthcare more accessible to those who need it the most in the state.
Thank you for that. And as we move on, the question is around prevention or actually maintaining in the state that we are in. So if a woman is pregnant right now, or someone that you love in your life is pregnant right now, what are some of the best steps that she can take? And what are some of the action steps that she can take right now, or if she's looking to become pregnant, that she can take to ensure one of the most healthiest pregnancy possible, if that's within her control?
I'm glad you added that's within her control, because I was thinking, well,
we know. We know some things.
It is, a daunting task, because I always say it, we can equip, and we try to equip each other with all these, advocacy techniques for us to advocate for ourselves. But when the system still doesn't see value in us, that's always an uphill battle. But one thing is to first find a provider. And I know that that's not always easy as well, because, we're a rural state and we don't often have, some communities don't have access to a range of providers. But finding a provider, if possible, that you're comfortable with, confident in, and that works alongside you, as opposed to providing directives as to what to do, is important. Also, I think creating your team of care within your support system. And so we always say, well, partner, husband, whomever, yeah, that's good. But also, what about family members, cousins, friends? So finding that group of people that you can confide in, that know steps to, advocate for you, know what's going on during your pregnancy. That's really critical, because, sometimes when we get in these moments, a woman cannot speak up for herself, as Serena Williams was able to. But we look at Kira Johnson, her husband was able to step in. Not, she still, unfortunately, passed away, but he still advocated for her in those moments. And so, you know, having someone that knows what you're doing. One thing that we have done is created a journal for Black women to take to the provider with them. And it's not just, you know, we have our pregnancy journals where, you know, we kind of journal all the happy feelings, which this is a part of that. But the other part of that is recording your blood pressure, because we know, you know, preeclampsia is prevalent in Black women. So recording your blood pressure, recording who you saw on each day. So whether it was a doctor, a nurse practitioner, whomever, putting that down, how you felt, how they made you feel throughout, and what questions you had, and did they answer those? And so that kind of serves as documentation. So should something happen, a family member or someone should have access to that document to say, well, you know, at 38 weeks, she was complaining about a headache and no one did anything about it. So, you know, it's here written down in documentation and you can't dispute that. And so I think that's a big advocacy, because the big part is we're not being listened to, we're not being heard. And that has deep, you know, racial and historical context to it. And so it's hard to combat that in this system, but, you know, we can try to arm ourselves as much as we can with these advocacy tools and surrounding ourselves with family members. I know when I had both of my kids, I told my husband, don't let them kill me. I know that's, you know, but don't let them kill me.
That's real life.
You know, having that plan and that birth plan as well, writing it down and speaking with your provider about, you know, what you want, what your wishes are, is important, and going and them respecting that is also important. So I think those are some things that I would offer up.
And Letitia, I'll just offer up too. You mentioned what you can do before you become pregnant. I don't think, especially young women, think about how to prepare themselves for pregnancy. And so when we do initiatives like reproductive health initiatives, that's what we're preparing women for. You have to be STD free. You have to exercise, the right diet, folic acid, all those things to prepare yourself for a healthy pregnancy before you are pregnant. And those are some of the things that reduce your risk for having any of those maternal issues. Prevention is really a key part of what we talk about in public health. And after you're pregnant, of course, you may have those other issues, preeclampsia, but there are some things that we can also do to prepare ourselves to be able to have a healthy pregnancy, and also know your family history. One thing that we know is that if whatever your size was being born, then more than likely, when you have your baby, it's around that same size. So you need to kind of know your family history. And that's one of the things I don't think we do well, and that's know what happened with our parents. And so that's another thing that we know. Are you at risk for high blood pressure? Are you at risk for diabetes? All of those things are important for you to know before you get pregnant. And then, of course, to monitor when you get pregnant.
Which brings me to my next question. What can the community do to help women, especially Black women, when it comes to the state's mortality rate? And Senator Frazier, I'm going to come to you and put that on the state level. What can the state do to address the maternal mortality rate? So whoever would like to discuss the community impact. And Senator Frazier, if you want to add community impact as well, by all means, please do. But what can the community do to address some of these issues? Because these are our community mothers that are dying. Our children, we have one less potential astronaut or one less potential fill in the blank when a young child dies as well. So what can the community do to address these issues? Because we know in this state that is very difficult policy-wise, rural, economically difficult state, that many times it's the community that has kept women alive. That is basically, as you know, Mary McLeod Bethune with what did she start Bethune-Cookman with? You know, it's not a lot, but we know how to make stone soup when it comes to keeping our community alive. So what some of the things that community can do to address these issues?
That's a very good question. This is a very good start. I think organizations such as Delta Sigma Theta can play a very good role in terms of educating the public in terms of what the problem is. And once you educate the public in terms of what the problem is, the public can educate the legislators in terms of what the problem problems we face. Legislators have a lot of power in this state in terms of shaping public policy. They can pass, they can defeat legislation, and they pass and defeat legislation based on what they hear from their constituents. If we hear from our constituents saying that this is a top priority, we will address that. One thing we're doing in this state, we're trying to make sure that we expand healthcare in this state. One of the problems we see is that we have a shortage of healthcare professionals. So we also pay appropriating money to expand that by admitting more doctors to the University of Mississippi Medical Center, and also coming up with different programs for them. We're also expanding money for rural physicians to go into rural areas. We pay for their medical school, physicians, dentists, other healthcare professionals. But one thing the community can do is have a forum such as this to educate the public in terms of what the problems are. And once they do that, they can come to the legislature and lobby to their legislature in terms of what should be done. Each person in the state has one senator, one representative on the state level. You can lobby them, let us know what the problems are, what we can do to address those problems. We do have the resources to address these problems, but like I said, sometimes we only move when we hear from our constituents, because if you make noise, we're going to listen to it. If you come up there and lobby, we will listen to you also. We have access to what we're doing because everything we're doing is online, the bills, our voting records. So you can't access that. So become proactive, because we hear from the other side all the time. But if we hear from you on a more regular basis, we'll be in a better position to pass good public policy and also address some of these issues that we're talking about tonight. But this is a good step in the right direction. Organizations such as Delta should become very active in terms of educating the public, and also encouraging them to get in contact with legislators so we can pass good public policy in the state to address these needs.
Excellent. I'll come back to what to do.
Let me step out for 1 second. I'm going to step next door.
Absolutely.
Be right back.
Absolutely. Dr. Burse or Dr. Melvin, what can the community do to not only bring attention, but also to support our mothers and our children?
Yeah, Letitia, and I'm not gonna follow directions. I'm gonna say community and state, but community, voting is a health behavior, and so we don't often think about how voting ties back to our individual health. And so Senator Frazier is telling us they're holding the power to our health, and so we have to start looking at our civic duties, our engagement in the civic process as a part of our health. And I think that's one thing, but also the awareness, of course, is important, but we have to know. So community can rally together. Dr. Melvin, I know she'll talk about all the work that they're doing in the community. We're doing, programs in the community around supporting mothers. If you know a mom that is expecting, get her a blood pressure cuff for her baby shower, and so that she can keep an eye on her her blood pressure throughout her pregnancy. And those, we don't often think about those things that around our health, but to be able to support in that way. And then on the state side, I keep thinking about these, we talk about providers and how providers, a big part of it is Black providers, not having enough Black providers too. And so then how do we get more Black providers? We need more pathways to healthcare for, our up and coming people who want to be in the medical field. We know there are a lot of barriers and roadblocks that, impede their access to just medical school. And so, so many Black people want to go to medical school, but you got, the process, not saying it shouldn't be competitive, but I'm saying that the application process is extremely expensive. So, that's expensive, and all these different barriers. We know all these tests that really keep us out. And so I think increasing those pathways also to professional school for our, up and coming, aspiring healthcare professionals is important. And also just identifying ways to incorporate healthcare or these messages around like the historical implications that play out now, that we continue to see today, that happened, when our people were enslaved. That's important because, we'll be written off as we just don't breastfeed, or they don't feel pain, or, you know, or she's just complaining and will just be written off, because some of the medical school education is still perpetuating some of these inaccuracies. And so being able to incorporate some of this into, you know, our professional schools, this education is important as well.
And that's an excellent point. Dr. Melvin, we're going to come to you, but I just want to add how most people don't know that the doctor, and I don't know his name off the top of my head, but who's thought to be the father of gynecology, did experiments on Black women. And those experiments were very painful and brutal, but it was under the auspices that Black people did not feel pain, that Black people had a different level of pain. And we know that those things persist to this day. Those racist and out of date tropes about an entire race of people. So just the practice of gynecological services is rooted in anti-Blackness and racism, and on the premise that we are just different.
J. Marion Sims.
That's him.
I knew one or both of you all were going to have that immediately. Y'all know my lane is more in political science, so if you ask them the politician who supported them, I probably could get you that one. But I know, and I know you all would correct me if I was wrong, but I do know the practice was developed on Black women, and he did horrific things under the auspices that we didn't feel pain.
Right. Which we now use for our current gynecological practices. But what I will do is I want to lift up a couple of projects. One of the things that, especially for Dr. Burse, working with non-traditional ways, because childbirth is an individual experience. So I think incorporating things like doulas and midwives are another way to improve maternal and child health outcomes, because it gives these women a more personal interaction with someone that can answer their questions while they're going through the childbirth process. And I think that, especially here in Mississippi, we tend to exclude doulas and midwives from the whole process, but I think it should be a natural process if a woman chooses to do that. The other way I think that as community organizations, we can improve maternal and child health outcomes is to teach health literacy, to know what to ask and how to advocate for yourself when you feel that something is wrong. If you don't understand something, or if you don't think something is right, it is your right to ask that question. And then the other thing that we're doing is cultural competence. We have a lot of providers that deal with Black women and don't know how to deal with Black women. It goes back to what Dr. Burse just said. I'm feeling pain, but you're dismissing what I'm thinking. So I think cultural competence goes a long way. The other thing I just want to say too is I'm the state health chair for the Mississippi State Conference of the NAACP. And I think that what we forget is that in terms of healthcare, that was a premier platform during the civil rights movement. And we have to go back to really talking about healthcare as a right, not a privilege, but a right to everyone. That was one of the platforms during the civil rights movement. And that's where Dr. Martin Luther King said his speech, where he said of all the injustices, removing or denying healthcare is one of the most inhumane. And so we have to just remember that it's our right to have good healthcare. We need to advocate for ourselves. And so some of the programs we do as community organizations is talking about health literacy, what to ask, what you need to know, and not being ashamed to keep asking a question or even going to a different position. Physicians do not know everything. They make mistakes like everyone else. So we have to know that when something doesn't feel right, it's okay to keep asking questions or even go somewhere else if we need to.
Absolutely. And I'm so glad you said health literacy. Could you all really speak on the concept of community health workers and the importance of keeping as we see the community health and keeping the community healthy, but how so important they are to pregnant and parenting women because of the hard work that they do, and in some of the communities that they go in. I know at the Women's Foundation, we work very closely with a group out in Cary, Mississippi, That's in Sharkey County for those who need a little geography lesson. But Sharkey County has had in the past one of the highest infant mortality rates in the country. But due to their home visitation program as well as their community health program, those numbers have come down dramatically. So could either Dr. Melvin or Dr. Burse discuss the importance of community health workers, and also what can the state do to promote community health workers?
Well, I think Dr. Burse and I do a lot of work together, so I think we both probably can talk about it. But the whole concept of a community health worker is recruiting someone who is part of the community to share the information, because that goes back to our whole conversation about trust. Usually people make changes if the recommendations come from someone that they trust. So the whole idea, and we do have a community health worker training program at the Institute. And the whole idea is to educate the community so they can go back into the community and provide the education that they need. And it could be about chronic diseases. It could be about maternal and child health. And now that we're in the middle of a pandemic, we actually have a module that addresses COVID-19 so that they can go out and address misinformation. So the whole idea is that you're taking lay people. You don't have to have a degree. You just need to know the right information to share. And you also need to understand how to help your community to navigate the healthcare resources that are available to them. So the other important piece of being a community health worker is also the linkage piece, being able to show people where they need to go if they need access to healthcare.
I'm ditto and Dr. Melvin on community health workers, but also I think you mentioned the home visiting programs. Those
Yes.
they're really, really critical. And Mississippi is not the only state that has them, but being able to go into the home and check on a mom after pregnancy, after delivery is very, very important. And, so that can help, identify some issues that mom may be having where she needs to get back into, a provider. So I'm agreeing around community health workers and the importance in our communities. And I think we do see some parallels between doulas and community health workers as well in serving moms, because there are postpartum doulas that go in and continue to support families beyond pregnancy.
And I don't know if we adequately defined a doula. If one of you all could do that, because I'm really big on in making sure individuals know exactly what someone does. We've heard the word, but someone on here may not know exactly what a doula is. Or even a midwife for that matter. But if you can just expound on that just a little bit, just to ensure that there's no one, we won't leave here without any doubt.
Yeah, so a doula supports a parent throughout pregnancy. So that's answering questions, identifying how mom wants to deliver, helping create that pregnancy plan. They even go so far as to helping mom around the house too. I at one time I wanted to be a doula, and then when they said they clean up the house and I was like, I can't even keep mine on clean. So let me figure out another way to support. But doulas do provide all of that social support and emotional support to parents, even through that postpartum period. So, and they shift their kind of services once mom gets postpartum. But a midwife can deliver. Midwives deliver babies. Doulas do not deliver babies. We don't have many midwives in the state, but we do have one Black midwife, Tony Hill, up in Tupelo, Mississippi, who delivers babies. And one
For the entire state.
Yeah, I think we may have one more. I may have seen that is coming into the state, or is just, or has just come here. But yeah, one Black midwife in the state of Mississippi. So, even our chances of having a different type of birth is, slim. And so just to even add to that, and I know this is going a little bit off of your question, but thinking about like doulas and midwives, we often say, we have been made to believe that this is some type of alternative care, or it's care that we don't have access
to. It's substandard.
Yeah, we don't have access to this care because, it's so expensive. But these services also started in our community. We took care of each other. And so when medical services became more, kind of as the standard. Y'all see,
Life.
as a
Keep
standard,
going. Keep going.
that's doula care and midwifery kind of was phased out. So, I think those services are all important.
Hello to your kings.
I'd like to interject a question. Are doulas and midwives, is that service covered under Medicaid?
No. And so that creates another inequity, because so if you have health insurance, private health insurance, you may have a health savings account where you can kind of pull some money and, do things that way. But no, you cannot bill Medicaid for doula services.
We do have a couple of questions in the chat. Someone asked, in Mississippi, what are the top 3 causes of maternal deaths?
So our report, and I don't want to get it wrong, but I'll definitely give you the top causes. Preeclampsia is very high in our state, which is high blood pressure, due to pregnancy. Heart disease is very high on the list in Mississippi. We had, I can't remember the number of deaths by suicide, but they were also a significant number as well as substance use. So I gave 4, but substance use was very high as well.
Well, we know in this pandemic, we know the need for mental health coverage and support is probably at the top of everyone's list, whether you're parenting or just a single person living by yourself. We know the importance of mental health and mental health coverage. So thank you for that.
And Letitia, I actually did pull the numbers. What Dr. Burr said was true, but I actually went and pulled it in preparation. And she's right. Cardiovascular disease and hypertensive disorders of pregnancy were 2 of the most common causes of pregnancy-related deaths in Mississippi. And 86% of pregnancy-related deaths occurred postpartum, including 37% after 6 weeks. Suicides and overdoses accounted for approximately 11% of the maternal deaths here in Mississippi.
Wow. And it's no better point to bring that up as we are in Go Red for Heart Disease Month here, to that women and their cardiovascular health is very, very important. Not only is when you're pregnant, but all through your life. We have another question. It says, this beautiful topic that's being discussed, I've been attempting to bring more awareness to our communities about this. How can the community get involved?
Well, I would say the most important way to get involved is, first of all, I think the advocacy component is really important. Make sure that we have people sitting in those seats that are actually advocating for us. That's the one thing that the community can do. Vote. Make sure you go out and vote, because those are the people that make the laws. Those are people that decide whether or not to expand Medicaid. So put people in places that represent your views. The other thing the community can do is know the right information and educate each other, so that they can advocate for themselves. Understand when you're pregnant, what you're at risk for, understand your family history, and be able to educate others about it. The other thing is, let's make sure we're doing that as young as possible, because I know here in Mississippi, we don't like to talk about things that may affect us adversely, but reproductive health is something that we really need to start talking about, really when people go into puberty, because at that point, it's too late after you start having babies to be talking about being healthy. So we need to start that before we start doing that. And sometimes that's as young as 12, 13, maybe even younger. So we just need to make sure that we're putting things in place to properly give the community the education that they need, and that programs exist for people to have access to the services that they need to remain healthy.
Absolutely. At the foundation, on our grant focus area, we call it reproductive wellness, because it's your overall wellness that deals with your reproduction. And we know that stands for women and men. While this is a form by women, but it doesn't mean that the men in our lives, as well as those who potentially will be fathers, don't need to be healthy as well. And I love what you said for advocacy, education, and vote. And it goes back to your health literacy. Just educating on yourself and educating, even if it's at the base level, knowing your basic anatomy. It starts with that. You'd be, and I don't even practice medicine and never will practice medicine unless the Lord comes himself and says differently. But the number of young people and just not so young people who don't know basic anatomy, and sometimes having just that basic knowledge of self will help you be an advocate for yourself. So I do love that, and the idea of voting. Voting is so important, and I know we ring the gong every election cycle, but voting, especially on those local levels, is so important. Who's your mayor? Who's your city council? Who's your judge? And then going up the ladder. Each election is so important because they have local consequences. They have real life consequences. We should not have been this long without Medicaid expansion in this state. And now we're at the point where we can tangibly count lives that have been lost due to the lack of coverage or the closures of hospitals. And we do have another question, and I just had a little soapbox there. Before I ask that question, I did want to give Dr. Burse an opportunity to answer the question on how can the community get involved with this issue of maternal health, and use that as a time to acknowledge your documentary.
Oh, thank you. Yeah, so I was thinking about the programs that we, Dr. Melvin and I all collaborate on. We do some work with mothers. And so we provide mental health services to mothers. We provide them access to doula support. And we just provide like a safe space. And so if whether I think I saw someone maybe on Facebook say something about the church, the faith-based community providing safe spaces for moms to come together or, to have sessions. That's important. There are always community baby showers that are going on that moms need access to. And then for the film, so we still do screenings of our documentary, and it does highlight the issue of maternal mortality in Black women. And it is very personal. It's a lot of my family experiences and friends' experiences. And, I do get a lot of statements saying, well, I didn't even know that this was an issue. Or, I knew someone died after pregnancy, but, after having a baby, but I didn't know what happened, or I didn't know that it was, this bigger systemic issue. And so, that has been a pathway for education for us as well.
And what's the name of your documentary?
Laboring with Hope.
Thank you. And go ahead.
And here that's related to what Dr. Burse just mentioned regarding the community, and it's coming out of the Facebook chat box. Are there any community centers that support particular needs for young mothers and mothers in general who may need counseling on these issues that we're discussing on today?
So Dr. Melvin, you may have a community center answer, but that also brings up another kind of gap. So we, of course, one part is that around mental health is that our community doesn't do, I won't say we don't do a good job, because I think we're coming around now and we're talking more about maternal health, but historically we have not, mental health, historically we have not talk much about mental health. And so there's also this gap in access to mental health services. And so, even when we're talking about expanding Medicaid, having access to mental health services is important. And so, there are some maybe local and state services that provide access to services like mental health. But the important part is, especially for Black women, having a Black therapist is critical. And that's because we can identify with those issues and, feel more comfortable and trusting of that type of provider. And I know that was kind of compiling on, but Dr. Melvin, I'll pass it to you around community centers.
And it goes back to what Dr. Melvin said about cultural competency. And as you chime in here, Dr. Melvin, I definitely want you to speak to the work that you do, because I believe that answers some of the questions around the community support, especially in some of the not some, but the amazing work that you are doing in the community. And I'm glad Senator Frazier is coming back because I have a question for him. But
Yeah.
go ahead, Dr. Melvin.
Well, the only thing I'll quickly add is that in most communities here in the state, we do have community health centers, and they do have a component that addresses mental health. But just to quickly say that, in our communities, mental health is stigmatized, or seeking help for mental health issues is stigmatized. So people may not readily access them. So I think one of the things we have to do as community organizations is to normalize understanding when you are feeling overwhelmed that it's okay to get help, and also understanding that community health centers a lot of times in your area do have that component that you can access. Another thing that people need to understand is a lot of employers have in their insurance policies a clause where if you need mental health services that you can get some free mental health. So one of the things that people should do if they have employer-based insurance is find out if there's a clause so that if they need to seek mental health services, they can do it at no charge, or at least have some hours before they are charged for the mental health services. A lot of people don't know that, and I worked for a long time before I realized that is a clause in some insurance policy. So that's another thing they can look at. And then just really briefly, the Institute for the Advancement of Minority Health was developed in 2019 to address health disparities within minority underserved communities. But the approach that we take is that we listen to the community. We use the community's issue or voice to lead our strategies for implementing interventions in the community. We don't just say, okay, this is the problem, let's address it. We try to do it with the community being at the helm of whatever the issues are that we're facing. And so we do have maternal and child health programs. We do HIV prevention. We have tobacco control programs. We address opioid misuse with our programs. Dr. Burse and I have also implemented a health equity task force, and it's a community-based task force. So we don't have any state agencies. We use them as advisors, but the community makes up the task force. And so for that, we want the community to let us know what the issues are and then help us to develop the strategies. So those are just a few. And of course, COVID-19, who will be in public health today and not do COVID-19 work? So we are doing that as well.
Absolutely. And she also addresses reproductive wellness.
Reproductive health. I'm sorry.
No, I just have to give you that plug because you, while not technically a current grantee, she is a grantee partner of ours, and has done excellent work around access to reproductive health, especially for Black women in the communities of Jackson. So I can't let her get past without saying that and we're glad that Senator Frazier has returned, because we would like Senator Frazier. We have a few questions, again, going back to Medicaid expansion. Could you explain to us what would be, even if you have any numbers, and Dr. Burse and Dr. Melvin, you can chime in after Senator Frazier, what would be the immediate impact? Let's say, would hospitals return, or would the medical corridor open up if the state actually took Medicaid expansion? Could you speak to the actual tangible impact to the state if Medicaid expansion were to come about?
Right. That will be a win-win for the state of Mississippi, in that we will be in a position to open a lot of those rural county hospitals that closed because of lack of funding. We will be in a better position to hire additional staff. We're losing nurses every day to other states. A lot of them being burned out, a lot of them leaving because of the lack of pay. We'll be in a position to pay them more money to retain them here in Mississippi. We're in a position to also look at what we're doing to educate more nurses and also healthcare professionals in the state. And also we can send additional money to a lot of health centers around the state. So immediately it's going to be a very big impact on the state, in that we will be in a position to treat additional people, employ additional people, and also it's going to generate additional revenue for the state of Mississippi. So it's a win-win-win for the state of Mississippi in terms of expanding Medicaid. It's going to help us open hospitals that are now closed. It's going to help us to employ healthcare professionals that we so desperately need. It's going to make healthcare more accessible in the state, and also it's going to put more money in the revenue stream in the state so we can spend that revenue on other things outside of the healthcare industry in the state of Mississippi. So it's a win-win-win for the state of Mississippi.
And now that we're doing away with taxes, we're gonna need that revenue.
You're crazy.
That's that's a whole nother forum. That's a whole nother forum.
Yeah.
But
It's a political game they play.
yes, Lord. But I do have another question for you, Senator Frazier. You said to when the loudest wheel gets the attention or gets the movement. In your opinion, what is the best approach for your everyday person in the community to contact their representative? How should it be letters? Should it be emails? Should it be catching them in the Kroger? What would you, with the mask on, but what would you say is the in your opinion and what you've seen to be effective manner to pester or be like the widow in the story in Luke who pestered the king until she got her justice? How does just the everyday person get their justice?
That personal contact is so important. You can contact legislators in Piggly Wiggly's, Kroger's, or Food Depot, or Dollar General, or Dollar Tree, because they're out about. Whenever you see legislators, grab them right on the spot and let them know your concerns. Letters are very effective. Phone calls very effective, and also visits. We have visits every day from different groups, but you have a chance to come in and just have one-on-one dialogue with legislators, and it's very, very effective. But don't be afraid to approach us when you see us in the stores, outside at ball games, wherever, because we are there to serve you 24/7, and we have to make sure that we put your priorities on the front burner. But like I said, you could write us, you can call us, you come by our offices, and email us. So that's very, 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 very effective. But like I said, don't send form letters, because we receive so many form letters over and over again and saying the same thing. And when you call the person back, they don't know anything about it. They just put their names on those letters. But know what you're talking about, and also be in a position to let them know how it's going to impact you personally. But contact us directly when you see us, call us, or just come by our homes.
Oh, absolutely. That is helpful. That is very, very helpful. I'm getting the nudge that it's about time to start it's about time to start rounding this forum out. We've had some amazing discussions, some amazing information provided. But I do, to piggyback on Hillman Frazier, Senator Frazier, pardon me, um, comments, is that there are many apps that you can download that let you know who is your representative. I would hope that people would know, but just in case you do not know, there are apps. I know, not to promote one in particular, but the one that I typically use is the Electric Power Association, and you're able to see your representatives not only on the federal level, but right down to your state representative and your state senator. Know who's on your city council and those names, but to know exactly who is your representative in the House as well as the Senate. Grab an app. You can enter your zip code if you don't know your county number or anything like that. But it's definitely good to know who represents you. While they may 99 chances out of 100 don't necessarily represent your views and actions, they're still your representative. I live in Rankin County, so mine is not necessarily representative of mine, but that it still does not stop me from contacting Senator Josh Harkin and giving him my views. We have one more question, and then we will go to everyone to have their last say. It says, to Senator Frazier, I'm an African-American NICU nurse here in the city. He mentioned assistance from legislature regarding financing doctors and prospective medical students. Is there currently anything available to support nurses who desire to advance their education and who are interested in continuing continuing work in minority maternal health care. I apologize. Basically, are there resources out there for continuing education, especially for nurses, and then as well as work with minority maternal health care?
That's very good. I appreciate that question. I serve on the Opera Study Committee, subcommittee. That's the federal funds that in charge of spending $1.8 billion from the federal government. And we put nursing education as a top priority in our recommendations. We have 10 priorities. With those recommendations, we make sure we address the nursing shortage and also what we can do to increase the nursing pool in the state. So we do have recommendations coming from the Senate side going to the House in terms of how we can increase that pool by making money more available. That $1.8 billion from the federal government was meant to address different problems in the state to solve problems we're facing. And we think that using this money in the healthcare field to increase the nursing pool is a very good investment in the people of the state of Mississippi. And also feel free to call us directly for additional information. I'll be glad to share my information with you, my number with you, 601-359-2886. And also you could just go on and just Google me and get all that information. I'd be glad to share information with you that will help you personally. But like I said, we also have the rural scholarship programs that's going to help nurses, doctors, and also other healthcare professionals. Because we realize that in order to address the lack of access of quality healthcare in the state, we're going to have to increase the pool in the state. So that's what we're doing. We're trying to allocate money to increase the pool so we can have more healthcare professionals in the state. We've been having battles between healthcare professionals in terms of access to care and also scope of practice. We are looking ways to empower nurse practitioners to do what they're trained to do, and also what they can do to remove some of the restrictions they have in terms of providing quality health care. So we need you to contact us, let us know that we should be doing more to make healthcare more accessible by giving different grants and also setting up programs to make it easy for our students to go to the healthcare profession. So those are some of the things we're doing on the state level to increase our pool of healthcare professionals and also to make healthcare more accessible and more affordable in the state of Mississippi.
Thank you for that, Senator Frazier. And I will add just a little toot of our horn at the Women's Foundation. We're also using our resources to address the nursing shortage in the state with the funder, in collaboration with our funder, with the Bauer Foundation. We're supporting 6 community colleges in Alcorn State with funds to help nursing students to make it through their programs at the community colleges and Alcorn to address their barrier mitigation issues, such as if they're having trouble with paying for childcare or scrubs. Our grants to those organizations are assisting with the healthcare field and those healthcare students. Someone asked, could you please repeat your phone number, Senator Frazier?
Yes, 601-359-2886. That's 601-359-2886.
Thank you very much for that. And as we begin to close out our time, again, we've had a wealth of knowledge, a wealth of information. We've had cameos from 2 of the greatest kings that I could ever lay eyes on. And I wouldn't have it any other way, but I will start with Dr. Melvin. And if you could add any of your parting ideas, your what is your hope for the state, and why are you so hopeful for the state, and especially around this issue?
Well, first, I just want to say thank you to the ladies of Delta Sigma Theta for hosting what I think is a very important discussion for our communities today. And my hope for the state would be that at some point we would recognize the importance of providing access to health care to everyone. For one thing, it's a cost savings measure. Every time that we have to provide care to someone who does not have insurance, those costs for their health care are imparted back onto insured members of the community. So we want to make sure that we increase cost savings. The other benefit of expanding Medicaid would be to increase access and availability of health care to everyone in the state. and or to most people in the state. And also we want to reduce health disparities. And we have had several studies that have shown that in states where Medicaid was expanded, that the result was better health outcomes for minority and underserved communities. So that would be my hope for what we would plan to do in this state in the near future.
Thank you, Dr. Melvin. Senator Frazier, same question. What is your hope for the state, and what are your feelings about this issue as we come to a close?
My hope for the state is that we will just sit down and get serious about governance, recognizing that we represent everybody in this state, including minorities, women, and others, to address issues that are going to elevate our state as opposed to dividing our state. My hope is that our members of the public will get in contact with us, let us know that we have to set priorities that are going to benefit the people of our state, the people we serve. Once we do that, we can see a big difference in this state. This state has so much potential. Leadership has held it back in the past, but if our constituents get involved in the process, they could change that. They could change leadership and make sure that we focus on things that are going to matter in this state and going to elevate the state and properly serve the people we represent.
Thank you, Senator Frazier. And last but definitely not least, Dr. Burse.
So I'm gonna try to make them all cohesive. Let me think. I've been writing down notes, so I'm trying to tie it all together. But just thinking about this is an issue of humanity, and we
Absolutely.
talk about it in a political way because that's where the power is. But we've talked about this is a right, and it should not be a privilege. And so I hope for our state that we can look at this as an issue of humanity. Also value Black women in, not just in the healthcare spaces, but even in our economic security. Cassandra Welchland with the Black Women's Roundtable is always fighting for equal pay for Black women. All of that impacts our health, our ability to provide for our families, our ability to, do the things that we need to do so we can see healthcare providers and we can close these gaps. And I also just want to issue a challenge, and this is not my hope for the state, but it's a challenge to our sorors of Delta. So now last week, Dr. Melvin and her sorors, they all had me out there with them AKAs, and they donated these blood pressure cuffs, and it was important to our program. It's important that mothers have an opportunity to do these measures at home because we know what the fight is in the system. And so even for us, when whatever you do for moms, someone is pregnant now, give them, just add that, in as a gift, and it will help. But I hope that we also on our end in the community do look at voting as a health behavior and how it impacts our health. And so that's what I'll say and wrap it on up. So thank you all for having me this evening.
Thank you so much, each of you. Voting is a health behavior. I love that, because without your vote, you're voiceless. Without your vote, you are voiceless. And if it wasn't important, there wouldn't be so many laws or so many activities trying to take it away. I cannot thank each one of you all on behalf of the Jackson, Mississippi Alumni Chapter of Delta Sigma Theta, as well as its Social Action Committee. We thank you all individually and collectively from the bottom of our heart for our chair, Dr. Kia Monique Jones, as well as our co-chairs, Ms. Sharita Young and myself. On behalf of our president, we just give you the insurmountable thanks, and we just applaud you all for the great work that you all are doing, for being the advocates that you are. And we pray that if there's any way that we can help, we will do it. And pardon me. And the final thing is, when you're buying those baby shower gifts, buy a blood pressure cuff. And with that, I will say good night and thank you.
Good night.
Thank you all. This has been wonderful. Great information.